To perform the individual manual muscle test for Flexor Digitorum Profundus, the patient is seated at the table with the forearm supported on the table and supinated on the table. The metacarpophalangeal and the proximal interphalangeal joints are held in extension, and the distal interphalangeal joint is flexed for this test. Stabilization is achieved at the middle phalanx, and generally this requires pretty much the whole hand over the finger with the thumb underneath the proximal interphalangeal joint so that you can really stabilize that middle phalanx in extension. Then go ahead and flex the tip, and resistance is applied at the distal phalanx in the direction of extension, just like this. Okay? That's the index finger. The middle finger is done in the same way. Stabilize the middle phalanx, have the patient flex their distal phalanx, and apply resistance into extension. Ring finger, same thing. Stabilize the middle phalanx, have the patient flex their distal phalanx, and apply resistance into extension. Small finger, stabilize the middle phalanx, have them flex the distal phalanx, and apply resistance into extension. Just like that. There really is no substitute movement for this, since the Flexor Digitorum Profundus is the only muscle tendon unit that flexes the distal interphalangeal joint. However, if the patient has short oblique retinacular ligaments, the oblique retinacular ligaments traveling from the volar PIP joint, essentially across the dorsal DIP joint and onto the dorsum of the distal phalanx. If that oblique retinacular ligament is shortened due to immobility or injury, the patient may not be able to achieve full distal interphalangeal joint flexion, and that may make it appear that the distal interphalangeal joint or Flexor Digitorum Profundus is actually weak, when it's really just that the movement is limited by a tight or short oblique retinacular ligament.